Hey guys, welcome back to the channel. And have you ever been to a doctor's office or an ER and the provider talked like this? Yes sir, the reason for your angina and dyspnea is due to a large pleural effusion, so we'll proceed with the thoracentesis stat. Now, if you work in medicine, you probably understood every word of that. But if you're some coal miner from eastern Kentucky, that may as well have been foreign language to you. One of my pet peeves when I'm at work is when I see a fellow physician or PA or NP using nothing but medical jargon when talking to a patient. And the patient just sits there, blank face, not getting a word of what he's saying. Which then causes the patient to be more confused and ask more questions, and the whole process just takes more time, and the patient becomes more stressed out in an already stressful situation. When I'm seeing a patient, I try my best to speak in simple, common terms and explain things to people like they're five. Because I feel like if you were more informed about what's going on, it makes the whole experience a little less stressful. As I've said before, I practice in Kentucky, and the people here aren't as well versed in medical terms as what others would be. You know, we're simple people here. But a lot of providers aren't like that. So today's video is not for the medical providers, it's for everybody else. I'm gonna go over a couple medical terms and explain what they mean. That way, if you do have a provider who just uses medical jargon, you'll at least be able to somewhat understand what they're saying. But first, this is Athena. Athena is a good girl, and she wants you to like the video and subscribe to the channel, because if you do, she gets to go for a long walk. All right, so the first term I want to go over is angina. Not angina, angina. And this just means chest pain. More specifically, chest pain from a cardiac source. Cardiac meaning heart. Now, there are several things that can cause chest pain. For example, if I were to push on your chest and reproduce that same chest pain, that tells me that it's coming from a musculoskeletal source, meaning you more than likely just pulled a muscle when you were working outside. When we use the term angina, we're talking about chest pain due to lack of blood flow to the heart. Now, why do we use this term versus just saying chest pain? Because the word angina is a lot shorter and quicker to say and type and document than it is to say chest pain due to a cardiac source. The next term I want to go over is edema. You'll hear this term a lot when talking about somebody who has congestive heart failure. And edema just means swelling due to excess fluid trapped in body tissue. Basically, when somebody has congestive heart failure, your heart isn't really able to contract strong enough to effectively pump blood through your body. And because of this, blood kind of backs up downstream and tends to pool in your lower legs. This causes fluid to be essentially forced out of your blood vessels and into the surrounding tissue. And this causes your legs to swell. This is why people who have congestive heart failure often have swelling in their lower legs, which is what we call peripheral edema, or swelling of the outer extremities. Speaking of fluid being in places where it shouldn't, the next term I want to go over is effusion. In edema, you've got fluid trapped in body tissue where it shouldn't be. But with effusion, you have fluid trapped in body cavities where it shouldn't be. You'll often hear this term when fluid ends up collecting in the places around the lung, called a pleural effusion, or fluid is trapped in the sac that encases your heart, called a pericardial effusion. And if they're severe enough, we get to take a big old needle and poke it in there and drain it out. I won't go into detail about what causes these things because a lot of things cause effusions. One example, again, being congestive heart failure. Now, you may ask, why do we use all of these random terms for? Why don't we just say the words chest pain and say the word swelling and things like that? And the answer is it's just easier and faster to document using these terms versus having to explain out what's going on. For example, it is a lot shorter and faster for me to document patient comes in with angina and pleural effusion, instead of me having to say patient comes in with chest pain due to cardiac source as well as fluid around the lungs. It saves me time when documenting and when explaining the case to another doctor, which means more time for me to see more people. That's it. But guys, that's all for today. If you would, like the video, subscribe to the channel if you like this content, and as always guys, stay safe and have a good one.